welcome everyone. Thank you for joining. We'll have, like I said, the chat up as soon as we can, so that we can get a better sense of who's here with us today. But again, as I shared from your registrations, it looks like we do have a lot of school districts on, which is really exciting for us. And we have a high-powered panel that I think will provide some really great information for all of you today to help you learn how you can access some funding that can really be a game changer, I believe, for all of the communities that are applying for it. So with that, let me introduce our presenters today. I'm Brooklyn Cadwallader. I'm with SOAR Partners. We are a social impact consulting and technology company in Tulsa. We are focused on helping nonprofit organizations as well as government entities and just do the good that they envision. It's kind of the simplest way to say that, but we work a lot in the grants and fundraising space, do a lot of grant writing, grant research, everything in that space. And then we also do work in the strategy and operations field as well as accounting, reporting, and compliance. But that's a little bit about us. And so we can kind of just go down the line of what we have on here with the presenters. So Terry, would you be able to introduce yourself?
Okay. Yes, I'm Terry Simonson. I'm a special counsel to the Attorney General's office. I've been there about 21 months, shortly after Attorney General Drummond took office in 2023. He asked me to take the lead in standing up the administration of the opioid settlement project or program, because the way the legislation is written, at the end of the day, the opioid funds come to the Attorney General's office. They are under the auspices of an opioid abatement board, and they approve grants. So my job has been to do a lot of teaching, a lot of listening. And last year was our first year, and we stood it up last year, made about 100 grants, funded about 100 grants. This is our second year. So we're learning how to do it, I hope, faster and better. And as Brooklyn said, school districts as a political subdivision can directly apply for the funds.
Thank you, Terry. And Scott, I'll let you go ahead and present. And I'm actually going to stop share for just 2 seconds while you do that.
Yes, my name is Scott Greenland. I'm the program manager for Rogers County and the City of Claremore Opioid Abatement Grant. So it's a joint application. I do not work for either one, but I work with all of those involved, and I work very closely with Family and Children's Services, which are associated with Nick and Mimi. Yeah, that's good for me.
Great. Well, thanks. And then Mimi, do you want to share some about you?
Sure, I'd be happy to. Hi, Mimi Taraj with Family and Children's Services. I've been with this behavioral health organization in Tulsa, Oklahoma for 30 years. We have over 70 programs throughout Tulsa County plus, and really happy, one, to be on this call today, and two, really concerned about the increases that we have seen in opioid use within our state, and happy that the Attorney General's office is being able to really help us address this complex issue. And I know that we're really happy to share some of the good work that we have done within several counties, particularly Rogers County. So I'll introduce and turn this over to Nick McMillan.
Yeah, I'm Nick McMillan, and I'm the lead data analyst for the Women's Justice Programs at Family and Children's Services. And I've been working with our organization and community partners and representatives of the OAG's office to apply for and implement opioid abatement funding for about 1.5 years now, since it became offered through the AG's office.
Thank you all. So yeah, like I shared, high-powered panel that I think is really going to have some great insight for everyone today. What I will go ahead and do is we wanted to learn a little bit about those that are attending today. And so while we're getting the chat back on, what I can do is launch a poll, and we want to hear what your biggest challenges or questions that have to do with the opioid abatement grant are. So you should see that showing up on your screen if you can answer for us kind of what is some of your biggest challenges right now? And we'll give you about 30 seconds to do that. We're seeing a lot of people say that they want more information or need more information about the program. And then some are also saying they're unsure what the eligible functions and activities are. So again, about maybe 10, 15 more seconds. Okay. And let me, okay, go ahead and we're gonna wrap up the poll. Okay. So sharing results, it looks like our winner was just lack of knowledge and information about the program. You are at the right place. So get ready to learn hopefully what you need in order to pursue it. And then unsure what eligible functions and activities are. So we're also going to cover that today. I think really hearing a case study like you will about what Family and Children's Services has been doing with Rogers County and City of Claremore, I hope will be incredibly helpful to you in answering that question. And then others were just lack of staff capacity to administer. Again, I think we have some resources we can share with you today. Hopefully that some of those that are on the call can even be a help if needed. And then lack of knowledge of what is needed in the community and lack of community resources and assets to provide services and implement plans. So thank you all for sharing. I did do something that I think should have allowed you back into the chat. So if you do want to attempt one more time and give us information, let us know where you're from. Thank you, Judy. I see you. Let us know what subdivision you're from and what your role is. That would be awesome. But as you do that, I'm going to go ahead and take us into the next part of our presentation. Okay. No. Okay. And with that, you might have questions as we go along. So we do have time for specific questions at the end. So if you will type them into the chat, which is part of, you can put them in the chat or in the Q&A, we'll catch them either way. And we'll make sure to answer them during our panel Q&A at the end. So with that, what we wanted to start off with was, again, we got a lot of answers about needing more information about the program. So that's right where we're going to start. So Terry, if you will take us away and just kind of share, and as you go along, if you just tell me when to go to the next slide, I'll do that for you.
Sure, thank you. And you can move through the slides, as you want, but I'm not surprised that the #1 polling response was lack of knowledge, because as I've been traveling the state and talking to people, they hear bits and pieces of it, but not that much. I think if you go back and think about it, I don't know whether it was 10, 15, or 20 years ago, you couldn't hardly pick up a newspaper or turn on a TV and you weren't hearing about the opioid crisis. It went back that far. And there wasn't a lot being done that we thought was being done about it, except states and cities, tribes started going after the people that they felt were accountable, the people they felt were to blame for what was a growing epidemic. And we lost a little bit of a track of that because then COVID hit. So opioids left the newspaper and the TV and everything was COVID. But the litigation against those they believed were responsible kept going. And at the end of the day, there were 14 companies that decided it was better to settle their role and responsibility than it was to continue litigation and fighting it. And those 14 ranged from those at the one end, like Purdue Pharma and others that made the opioids, to people companies you would never have heard of that distributed it. It included the marketing folks that misled you about it. And then it was the people that sold it, your local drugstores. In total, it was 14, and they agreed to a combined settlement amount of about 55 billion with a B dollars. And they each agreed to pay a certain amount. I suppose it was supposed to match up with their culpability over a certain period of time. Ultimately, it's 18 years. The payments are made to states and cities and counties based upon a formula. Generally, whether you see it as good news or bad news, but the good news is if you get a lot of money, it's because you got a lot of bad news there. You need the money, whether it's the overdoses or the overprescribing or the addiction or whatever it might be. The estimate I've seen is Oklahoma's share could be anywhere between 400 and $500 million over that period of time. Some cities and counties apparently are getting money directly themselves, but for today's purposes, we're talking about the money that's coming to the state of Oklahoma. Throughout the year, money comes through the settlement court, comes to the state treasurer, I think. And then sometime during the legislative session, like right now, the legislature moves those funds that they've received over to the Attorney General's office. And that process will repeat itself for 15 more years. The state receives it, goes to the Attorney General, and then they process it. Now, why is it going to the Attorney General as opposed to the Department of Health or Mental Health? Well, early on, back still, I believe, when Mr. Hunter was the Attorney General, the legislature passed 3 laws that they thought provided the important structure. So how are we going to go forward into the future with this money? One was that no one person was going to make the decision on where the funds went, not just the governor, not just the Secretary of Health, not just the Attorney General, that there was going to be an opioid abatement board. The board is made up of 8 appointed people, and the Attorney General is number 9. And the appointed people come from elected officials, like the governor, president of the Senate, Speaker of the House. So these individuals are the ones that decide on the distribution of the money. That was the first law. The second law was who can apply for the money. And the legislature decided that it needed to be political subdivisions, essentially, or entities like city, counties, or schools where the supreme governing body that oversees them are people that are elected. So whether it's a city council or a mayor or a county commissioner or school board, they felt that they were responsible for accounting, auditing, cash control, purchasing, legal. It was already built in. So from what I understand, that's why they decided that they would be the designated applicant. And then the third law was, well, what can it be used for? And the third law is the approved purposes. And there's 20 of them, all broad, all came from the court, part of the court settlement. They're all included. There's more that could be included. So you look at the statute and you see, okay, I know who's going to decide where the money goes. I know who can apply, and I know what they can apply for. So last year, the Attorney General had $25 million. Actually, I think it'd been there a while. And he asked me and some others that he hired, like Healthy Minds and some staff people, to figure out how to stand up the administration of this and get the word out so that the cities and the counties and the schools and the career techs would know about the money, what it could be used for, and when to apply. Last year was the first year. We had approximately 100 successful applications. And if I remember correctly, a significant number of those were from the schools. The schools figured it out. I know I've been communicating with superintendent associations and organizations in any way and every way, to spread the word. So we gave out about $12 million across the board, city, counties, and schools. The legislature refilled the bucket last year. So now we start this year with about 29 million. I've sent information like this to Brooklyn to share with you. School districts, as I said, they can apply. One of the most important things for the school district to remember, though, is that the superintendent alone can't just send in the application. The school board has to approve the submission of the application and with a resolution. And I believe I sent Brooklyn an example of one of those from a school. It's a very simple document, but it's just a way of confirming that the school board knows about the application, they approve it, and they want it submitted. Now, the reason I mentioned that, because I didn't really get this last year, is I don't know how often school boards meet. And there's timelines for getting things on an agenda. So with the application period opening next week, May 12th, and then it will close in 1 month, June 11th. Sometime in that window, if you're a school that's going to apply, please remember to have something on your school board agenda so they approve the application, or excuse me, the resolution, so that it gets submitted with your application. That's
Yes.
it's really important. Because once it closes, I don't know that they're going to let you say, oops, I forgot to get that part, and let you go back and get it. I don't know that they would let you do that.
And if anyone would like an example of that, like Terry said he sent, just contact the same email info@SOAR Partners, and we can get you that example for you to look at as a resource. And Terry, I'll keep following you along here. And I don't mean to stop your flow, would you want to speak to these priority uses? Because I think these can be sometimes confusing on, okay, this is all I can do, or can I do things outside of this?
Right, sure. So the abatement board, even though it had these 20 approved purposes, focused in on these 8 you see here as priorities. It's not exclusive, meaning it has to be these and nothing else. But if what you want to apply for is on this list, one of these items like school-based prevention, then they're going to know you're starting off on the right foot, because you're starting off with a project that they're looking for, that they thought would be, should be a priority. And as I mentioned, there's a lot of information out there. I think Brooklyn will share to you. Go to the Oklahoma Attorney General's website. There's a link, and you'll find this information right here about the priorities. You'll also find the list of all the schools that were approved last year. You'll see the rules. It's a work in progress, but please go to that website link and share it with people. I think soon, maybe the beginning of next week, the actual application will be up there. It's online. You don't mail in any papers. But that's where it's filled out. As I mentioned, after it closes in June, 3 members of the Opioid Abatement Board raised their hand and said they would be the reviewers. So they will be reviewing the applications. They may need more information. They may have questions, but they're going to have a month to do that. And the Opioid Abatement Board will then meet on July 31st. And the anticipation is that on that agenda, the review committee will have recommendations of projects and funding for the board to approve. At this point, there's not any expectations that anybody has to show up and present. They didn't last year. Okay, so once it gets to the board, it goes pretty quickly. The funding is likely then to flow in August and September. There is an agreement that the school would have to sign with the Attorney General's office. And if it's approved and in your application, you actually were wanting to contract with, like, let's say Family and Children's Services or someone to provide services, then there would be a contract between you, school, and the provider. Okay. So think of it like this. Every time money moves from somebody to somebody, there's got to be an agreement. So when it comes from the AG to you, there's an agreement. If it goes from you to Family and Children, there's an agreement. And we have a boilerplate agreement. So it's not difficult to do it. It's pretty simple, and the services are just filled in by the provider. And that's pretty much how it will go. I think it'll go pretty quickly. SOAR is a great resource. The Attorney General's office also retained Healthy Minds, and their job, Healthy Minds Policy Initiative, is to provide insights, examples of things, programs that they know are good evidence-based programs that work, that have been working. I'm not saying that you have to do or should do what a fellow school has done, but when you see this list of schools on the website, it doesn't hurt at least to ask them, what they did to be approved, how it's working. But you can still do your own thing. There has to be some type of needs assessment. Lots of money has been going for training from the BotFin's life skills. So there's a lot that can be done, Brooklyn.
No, thank you, Terry. And I think that's really key. From what I've heard from you and from the Office of the Attorney General is they really want to understand what is needed in your specific community. And I think sometimes when people hear the word needs assessment and evidence-based strategies, it can suddenly seem bigger than you even want to deal with. But Terry, I know on the website you have some tools for people to use to really just do a general needs assessment, to say, hey, this is kind of what it looks like for my school and what my school needs, and then to pull some evidence basis. Again, if you're a school, the school-based prevention is part of this. And then if you're a county or another political subdivision, there are examples, and you'll hear one today about how people have been able to access that funding for their community. So hopefully all of that can be helpful. Terry, do you want to speak to just quickly kind of the grading rubric and what the perspective of the office is on these applications?
Sure. What you're looking at there is what each of those reviewers, the 3 reviewers, will have as they look through your application. A simple yes, no, in terms of, the questions that are right there, and then the overall scoring. So, I mean, you really want to make your case. I mean, this is really what it's about, is that I promise you, if you're a superintendent, you may not know what the needs are, but I can promise you there are people in the school or in the community that do. They just haven't always come to the table together. And this is the time you bring them, okay? Healthy Minds can help people connect with data if you need data. It's there. So, the key is, in order to secure the money, get your team around the table. Family and Children, a lot of people can help you at least with an outline of a needs assessment. So in other words, what you're describing is, here's my problem, and this is what I want the money to go to solve my problem, okay? Generally speaking, that's what you're trying to do. And there are people in your community that know it. So as Brooklyn said, you'll see there on the bottom, it's pretty subjective, but that's what the reviewers, there's 3, they'll be looking at it and they'll be scoring it or circling, is it unsatisfactory? Is it excellent? Any concerns with the budget, anything like that. They're the reviewers. They're not the deciders. They'll bring a recommendation to the board in July, and then the board will decide to fund or fund partially or whatever might be the decision.
And those key places.
Brooklyn, can I just add something to it?
Yeah.
There's a lot of school districts on here. There's also probably some familiarity or lack of familiarity with what types of services need to be provided. And my guess is that most counties will either have a connection to Family and Children's Services, Grand Mental Health, Creoaks, and all of us are doing this level of work and working with substance use disorders. And I know would be happy to really assist in this area. So I do want people to know you don't have to be experts on what to do with opioid disorders. That's the work that behavioral health organizations provide. And the opportunity to work with school districts or with any of the contingencies is really part of our mission. And we want to push this out as much as possible and utilize these dollars to really impact people in every one of these communities. So my point is, don't feel like you have to be experts on this. That's what the providers are here to do.
So well said, Mimi. Thank you. Yes, you don't have to go it alone. I think it's really key. And in fact, I mean, it even says here in the proposal that they really value collaboration. So I'm seeing here that they love to see evidence-based practices, which a partner like Family and Children's Services can help you with in dealing with substance use disorder and in preventing substance use disorder. Having a clear, feasible implementation plans showing strong collaboration and a robust evaluation and sustainability strategy. So definitely recommend having a team member to help. And
So
with that,
I'll add, building on what Mimi was saying. So I mean, yeah, the one thing that makes this funding mechanism really interesting is that who is eligible to apply aren't necessarily entities that do the work, aren't necessarily the ones that implement opioid abatement strategies. And so it's necessary to bring people together to put together an application. So like a school district or county, because maybe they're not typically equipped to implement opioid abatement strategies, can work with a local CCBHC or a social services or substance use treatment provider to put together that application. And a lot of that knowledge for what goes into community needs assessment, the providers will provide, as well as the people that you gather around the table. I mean, it's not only providers, but other community stakeholders, maybe people that work with youth in the county. And all those perspectives, the health department can help inform the application and the community needs assessment.
thank you so much, Nick. Very helpful. And with that, I mean, you might be asking, I know some people, this was really a brand new program that you'd heard about. So this is what we're talking about the kind of funding that you can pursue to do these projects in your space. So we keep speaking to school districts, but for school districts, even those that are up to 2,000. So if you're a smaller school district, you can still apply for, you can apply for up to $105,000 to be used for projects in your district. And then, I mean, you can see counties that you can go up to 900,000 municipalities. It's all about what is the size of the population that you would be serving in your specific instance. So, but there are some real funds. I mean, props to Terry and his team. These started as smaller tiers. And honestly, for smaller municipalities and smaller districts, it was probably hard to get much done with the funds that were originally proposed. And Terry and his team kind of talked with the board about that in order to get them raised, get these tiers raised to a dollar amount that actually made more sense and could do even more work on the ground. So again, these are real dollars that you can apply for. And I'll say too, what kind of sets this program apart from other programs I've seen is they actually have a cycle. Terry, you may want to speak more to this, but after you put in your application, if there are issues identified with it, they do give you an opportunity at times to reapply within that same grant cycle. Terry, I assume that's still happening this year. I know that is something that happened last year.
I believe so. And one thing I want to point out here, we've had this conversation with some trying to get it clarified, that the dollar amount that you see is for a 3-year term, up to a 3-year term. Okay. So I'm not sure who within the AG's office determined this. To your point, they did want to get more money out. They wanted to at least commit, promise, or obligate more money to go out. They tripled the amount of each of those levels of the tiers from what it was last year, from what I understand. That we've had some discussions about that. There's some programs that, may need more than this. They may need to find a different way to approach it. Maybe the collaborative way is to approach it. Maybe it's not. Maybe you go alone. Everybody's going to have to kind of figure that out. That's partly what the staff, Jill Nichols and Jessica Hawkins, are to help people. I mean, at the end of the day, we don't want any of this $29 million left in the bucket when the grant period is closed. So my way of thinking is then we should do everything possible to make sure that we remove any barriers where that would happen. So if you don't want it to happen, then don't do things that might cause it to happen, even if it's inadvertent. So the tiers it could be one of those areas.
Yeah, no, thank you. Very well said, Terry. And I encourage you, if you're have any questions about this, please do reach out and put questions in the chat because we will come back around as part of the Q&A.
Maybe one final thing, Brooklyn, because in the last couple of weeks, there's been a lot of news coming out of Washington and maybe even the Oklahoma Capitol about funding being cut. People losing grants and loans and stuff. And understandably, some people thought we were talking about that included this money. It doesn't include this money. Okay. This is not taxpayer money. Okay. This does not come from Congress or the president or the governor. As I mentioned at the beginning, this is corporate dollars from settlement funds that go through a federal court. So you don't have to worry, as I've had some saying to me that they thought this would all be going away because they'd heard that grants and such were being cut. I said, not this. Okay, this is, I can't speak to others, but I can speak to this.
Excellent point, Terry. Thank you for sharing that. Yes, these are funds that are definitely going to stick around because they're unencumbered as to some of the other things that are going on.
Yes.
Well, next we'll launch into a case study where you can really see and learn about what this looked like on the ground for Rogers County and City of Claremore. Family and Children's Services is currently partnering with them to run this grant program. So with that, I'll go ahead and hand it off to the Family and Children's team. And just like with Terry, just let me know whenever you're ready for the next slide. But y'all can kick off.
All right, I'll jump in here. Nick, you jump in whenever you're ready. Interrupt me. Let me give you a little bit of a foundation. I realize that most everyone here is associated with a school, and we work with schools. In fact, my background, I'm a former teacher and coach, and so is my wife. And so not long ago, in fact, about a year ago, I was dealing with this at that level. We were dealing with issues in the bathrooms. You name it, you know exactly what I'm talking about if you're in a school district. And so when I came on board, one of the things that I heard immediately was we wanted to focus on prevention and focus on our students in our county. So our structure of this application is a joint application, and you can see there on that slide that we have an advisory team. It's not really a board, but it's a team of individuals who come from all different areas. As you look through there, different aspects, and we all can connect in different ways. This team began before I ever started and got things rolling. And the input from each of those individuals is valuable. And it's hard to get everybody in the same room, but when we do, it's really incredible. And how would this apply to a school? Most of the schools in this meeting are pretty small, less than 500 or so. It wouldn't take that much to get a handful of people together and start sharing the stories and sharing, this is what I'm seeing, this is what I'm hearing, these are the issues that I notice, so on and so forth. And that's basically what we've done at the county and the city level to get our structure going. Brooklyn, if you go to the next one. Within that is as a major partnership with Family and Children's Services, and they handle some of the areas that we focus on completely, and some of the other areas they do not. But we collaborate as we build a network of partnerships, which has been incredible. The partnership building, I'll speak to that more in a minute, has been a blessing more than a chore. Because people want to see their community improve. They want to get rid of this problem. Everyone's been affected somehow, and they want to be a part of the solution. And coming together at the table, whether it's in that collaborative group or with partnerships in the community, is one way to do that. So these are the areas that we focus on. Now, it doesn't mean you have to focus on these, but I'll read it through it really quick. The GED in jail, parenting in jail, and women in recovery are specialized through Family and Children's Services. And then I've been handling the school-based prevention, harm reduction and training, recovery housing, as well as some with Family and Children's Services, and then community events, excuse me. Nick, why don't you jump in there a little bit on what GED and parenting and women in recovery is?
Yeah, definitely. Well, the first thing that came to mind too, Scott, was that you've been handling the school-based prevention, but like not you personally, you've kind of found local community providers doing that work in the school districts there in Claremore and Rogers County, and engaged them, which is, I think, a good example of sort of building this kind of coalition of community partners on a opioid abatement project like this. And Mimi might be a better place to speak to our GED, parenting in jail, and women in recovery programs.
Well, I'll start with women in recovery. We were really dedicated to decreasing incarceration rates for women after learning 3 decades ago that we had the highest incarceration rates for women, not only in the country, in the world. And fortunately, we have been able to drive those numbers down to 4th place. However, we still have an incarceration rate at almost twice the national average. So there's still a lot of work to be done. When there's criminal legal involvement and individuals who have struggled with opioid use or mental illness, separation from children is really a struggle and it's quite devastating. So we provide both community as well as in jail parenting classes. Following evidence-based curriculums. And if you're interested in that, put it in the chat and we'd be happy to follow up with you as to some of the specifics and what that looks like. We are seeing an ever increasing number of individuals in Oklahoma, both men and women, who do not have their GED. So this is pretty disconcerting, I would imagine, particularly those that are in the educational space. We read a Georgetown study actually this past week that indicated that in 2030, 90% of jobs in Oklahoma will require a GED. So for individuals that might be struggling or have dropped out of school environments, we are providing GED classes both in the community as well as in jail settings in multiple counties. It's a laborious process. However, it looks very different for somebody whose last year might have been 3rd grade versus 11th grade. And so we have all special ed teachers who are really refined in making this a very successful, well-intentioned, pretty compassionate way of teaching. And so again, if you're interested in what are those GED classes look like, put it in the chat. We'd be happy to follow up with you. We think it's really critically important for individuals to acquire this basic education.
Yeah, and I'll just add that the GED classes, they start in jail, and with through various means, including a mobile education and employment lab, a van, we're able to continue those because a jail incarceration may or may not be long enough to complete a GED. It can be, as Mimi described, a pretty laborious process and can vary wildly in terms of the study that's needed. If somebody's last grade was, 8th grade versus 11th. And so we're able to pick up that instruction and continue that process in the community as well.
Thank y'all for sharing all about that. And Scott, do you want to share some about collaboration and partnerships? I know you've kind of been sharing some, but I was interested what these photos were for.
Right. So we've done a lot of collaboration, and I have a list on the next slide. I have a list we'll get to in a second. But these two pictures on one side, they're holding backpacks, and those are boxes of Narcan or naloxone. And we're partnering with the local schools. We have 8 school districts, and this particular one is Foyle Public School, which is our poorest and smallest, most rural school, with the school nurse and counselor / 100 other things. I can't remember all the things she does, and the superintendent / bus driver / basketball coach and 100 other things. You know how that works if you're a small school. So we were able to give them some school supplies that were surplus from a event we did. We supplied naloxone or Narcan for every teacher. We paid for training for the counselor to be able to teach that. So she will go to all the teachers and give them the Narcan to put in their desk, give them training. And then we also ordered them opioid overdose kits, which are very expensive. They would have never been able to afford them. And they're going to place those in high traffic areas like the basketball gym, the football field, and the admin entrance area. And the other picture is a partnership picture from Rogers State University. Rogers County, we have RSU right in the middle, and it is a high population area for our county with, as you can imagine, college students, opioid issues. And to one side there, the lady is the drug prevention coordinator on campus, and then myself and Nick, and we partnered with their safety week, which was right before spring break, car safety check, where the campus police checked oil and wiper fluid, tire pressure, and all that before students left for home. And while they were there, they got snacks and they had access to medical lock bags, information. There were boxes of Narcan, a few other things, some goodies, some air fresheners, and then you see the red box. We did a sharps collection and a pill collection, like a drug take back collection, which is the first time that had been done on the campus. And the goal was to not only provide those things, but also that closer interaction with the campus police. Those were the guys checking the cars and things like that. And so that partnership was a lot of fun. And then from that, the moments in between, standing around talking, a bigger partnership is in the works. We're looking at connecting together for a much bigger plan campus-wide, where our county and city can partner up with the Rogers State University in their efforts to reach and educate, prevent, and do harm reduction. If you'll go to the next slide, or continue that thought. These are our partners at the moment, and hopefully this list continues to grow. Right side are all of our schools and our university. And when I say we're partners with the schools, some of those are going really well. Some of those are in the infant stage, but we're connected with the resource officers, principal superintendents, anybody that we can, to try to find out what are the issues that they're dealing with. How can we help? Can we provide Narcan? Can we provide training? Some of these schools, I'm going to go in and do professional development training with the SRO. Together, we're going to do that. We'll bring in some latest trends. We're going to do whatever we can do to partner with the school and help them in those efforts. And then on the left side, you see several entities. Rogers County Youth Services and Key Choices are two that handle the prevention, school-based prevention programs, which are phenomenal. We are so lucky in our county to have them. They were already in the schools, and now we're going to beef up their efforts tremendously. Not everybody has that, I realize that, but we're networking across the state too to try to figure out how other places can help. I can tell you Key Choices can go statewide, and what they do is phenomenal. And then other names like She Brews and Hope is Alive, Amazing Grace, and Live Free are all recovery houses in Claremore that we're partnering with. She Brews has 9 recovery houses, and we're not just partnering with the recovery housing portion of it, but as was mentioned earlier, the GED portion going to the recovery houses, different services that are overlapping. And then some of these services, like Standing in the Gap, would be in connection with transitional services of people coming out of jail. Zero Overdose is a recent one that we're connecting with Rogers State University to develop a safety plan. And the list goes on. The point is the partnerships are key. And that's where the flow really starts to go in and out, of finding those entities that this is what they do. This is their profession. This is their passion. Let's line them up, get them connected, get them funding, and let them do their thing. Sorry, Nick, I didn't give you a second. All right, it's gone. Too late. All right, service project, kind of the project. There on the one side is a. I'll let you in a second. I'll shut up. I promise. I don't know if that's a parenting in jail or GED in jail. That's a very nice setting. I attend the GED in the parenting in jail setting in Rogers County, and it's a room about a quarter of that size. But I can tell you that it's incredible to see what goes on in there. And then the other picture of the lady pointing is a retired teacher in our community that is actually the founder and CEO of the Key Choices, and they're holding the prevention classes. And if you don't know what a prevention class is, it's basically a life skills class that incorporates drug education, alcohol, tobacco, bullying, violence, good choices, healthy eating, and a lot of other things. I was a prevention specialist and enjoy teaching those classes, and they do make a difference. And so I'm a big advocate for that. Okay, Nick, your turn.
I was just going to add that the naloxone distribution and other of the strategies that we're implementing have been identified as priority strategies by the Opioid Abatement Board based on research and recommendations by Healthy Minds Policy Initiative. And so those can be a really helpful tool for guiding what programs are identified for implementation as you work with community partners and providers on developing a project.
Well, thank you all. It's so helpful. It has been so helpful for me to learn more about what has looked like at Rogers County and City of Claremore to run, I mean, all of these programs. It's amazing everything that you've been able to accomplish through accessing this grant. So thank you for sharing. To round out kind of our conversation before we go into Q&A, I'm just going to share some things about how to strengthen your application, some ideas and thoughts, and kind of wanted to give us an application landscape to start with that. Terry, you helped me with these numbers, but there are over 1,400 eligible entities which can apply in the state of Oklahoma. But in 2024, only about 100 did apply at that time. Of those, 71 were approved in the first round and 31 were invited to reapply. Remember when I said that there might be, a pathway forward, even if there was an issue with the first application. And that to me always just signals, hey, try. Just put in an application and try, because there might even be a chance for you if something goes wrong to be able to reapply in that round. And so awards equaled $11 million in this first time. And all of this was after the Attorney General's office received over 200 letters of interest. So the big question that Terry and everyone was asking is, why were so few applications put in? And that goes back to the questions we were asking you at the beginning. What is kind of the barrier that's getting in front of people, and how can we respond to that? And so these are the common reasons. You've already seen them because of the poll, but our message to you is there is help. And a lot of those people that can help are on the call today. I mean, I'm here with SOAR. We can be a grant writer to support your application. You can contact us at that same email, info@SOAR.partners, and we'll work with you to develop a quote for our costs to write one. Family and Children's Services, Mimi and Nick, please forgive me. I didn't ask you this question before we got on the call today. Are you able to help people throughout the state of Oklahoma? Or are you primarily focused on northeastern Oklahoma?
Yeah, we're focused on northeastern Oklahoma.
Great. Okay, and so then we have here Family and Children's Services or similar nonprofits that do similar activities to them can be your project partner. If you are in northeastern Oklahoma and want support from an organization that you can contract with like them, you can head to their website. Healthy Minds Policy Initiative. So I know we've brought them up a couple times. They have been contracted by the Oklahoma Attorney General's office specifically to help provide technical assistance to applicants like you to answer questions about the application, about what can be applied for, all of those things. So please do reach out to them. You can contact them at jhawkins@healthymindpolicy.org. That'll get you in touch with Jessica Hawkins over there. She works with Terry over at their office. And then this link we have here, and we can, I think, probably put it in the chat to make it even more easily accessible for you. But there is a web page dedicated to this that has all sorts of resources that I promise you can be a huge help. And with that, so those are some resources that you have access to. And then I also have some tips and tricks I wanted to share with you from a grant writer perspective. I will breeze through these quickly so that we can go into our Q&A, because I want to make sure that we spend some time there. But my biggest tip probably to everyone is just consider what you're already doing. People often assume they have to do more work than needed or start a completely new program to go after grant funding. I always encourage people, look at what's already in your hands, look at what's already being done. Is there anything that's already in process that you could expand? Or are there programs that you already have ready to go that are just waiting on funding? I always encourage people to pause before going to try to build a whole new program in order to apply for something. Think about if there's something that you already have in your hands. Consider your network. We've talked a lot about this. It may not be the answer for everyone, but collaborations can be a game changer for your application and your project. Are there any other public entities on this call or that you know that you could work with? Are there coalitions? I know that there was a coalition that applied last year. Is there a coalition that you could bring together of multiple partners? And again, Rogers County and City of Claremore is a great example of this in the collaboration network that they brought together. Another big tip that I always tell people is just read up. When funders release information, it's because they want you to read that information, and it can make a big difference. So pay attention. There really are great resources, like I said, on that official Opioid Abatement Grant website. So I would encourage you, please do go check that out and read the resources that they've made available. Take creative approaches, think in the long term. An idea that has come across from people that have gone after this grant is to even look at contracting or hiring an opioid program manager who can manage the funds and ensure success of the program. So instead of just thinking, oh man, I don't have any staff who's going to be able to run this program or who can administer it, there may be a way to even apply for that in the application. So consider if that could be a path. Again, I bring this up to everyone. Consider your indirect costs. Know that for this program, up to 5% of the project costs can be for indirect costs involved with project administration and reporting. So make sure you remember that in your budget, because that can really help with making sure you have dedicated staff time available to help with administration and reporting. Another tip that should keep in front of you is to start with the details. It's every time that I've gotten a grant application in front of me to start writing on, I always want to start with the narrative and the budget, really the meats and bones of the project. But what hurts you in the end often is the details. So the file you didn't realize was going to be due until you were going in to turn in your narrative and budget. In this case, note the requirement for a board resolution, like Terry so hopefully brought up earlier. Those can be the killers at the end of an application process. So make sure that you are considering that here at the very beginning and taking note of everything that's going to be required to put in that application. Next tip, we have 3 more of these. Don't reinvent the wheel. Resources like Family and Children's Services, as we've been saying, and other nonprofit partners can help you. If you feel like, man, how are we going to build a needs assessment from scratch? How are we going to build a project from scratch? There are others who can help you if you reach out for some insight. I always say stay positive. Remember, in this case especially, you're working with a funder who wants you to succeed. They want to give these funds out. They want people to be using them throughout the state of Oklahoma. They have a lot of funds that they need to give out by statute. And so whenever you might feel buried under the application or feel like, I just don't know if we can do this, remember that you, again, have a funder who's contracted technical assistance. They want you to be successful. And I'll just end with that, really saying, remember, there are many versions of success. Our message to you probably today is, man, go for it. If you think you can make a difference in your community with these funds, go for it. And we always tell people who are going after grant applications, like, your work isn't wasted. This is a multi-year, and we'll go for another 18 years that this funding is available. So a no in this round doesn't have to mean a never. So you can always take what you do in this round and use it next year if you weren't successful in this round. So Mimi, did you raise your, I'll stop.
I did. I want to tell you, when we were probably one of the first to write a grant for opioid abatement funds, and we didn't have SOAR. And so I think it's really terrific, Brooklyn, that you are putting this out, because not every organization or agency has access to grant writing. And it's an art. And thank you for inviting us to be a part of this and to share our work. And again, as both Nick and Scott and I suggested earlier, reach out to either of us, any of us, for questions, directions, and input. We're happy to help.
Thank you so much. So well said. Well, thank you all. We'll go into our Q&A. And I know also it's telling me we have at least a couple of questions that got brought up in the chat. So also, will you read out for us what's coming? And if you have more questions, please continue to put them in the chat.
Yes, thank you, Brooklyn. So we have a question from Rachel McCaleb that says, can the county and the school in the same county also apply?
So can the county and a school in the same county apply together? My understanding has been yes. Terry, do you have, I
Yes.
would consider that a collaborative application, but have you seen that specific instance with the board?
Yeah. Yes, I mean, they're both independent political subdivisions, so they both are eligible to apply. If they want, they can apply together. City of Tulsa and Tulsa Public Schools, they came together. I don't know what their application was, but they came together. At the end of the day, in addition to the collaboration, look at the tier chart and see where you get the most money. Okay, do you get more money if you go together? Then maybe you should. If you get more money going separately, do that. Okay, so but there's no prohibition against two coming together. One needs to be the applicant, of course. Okay, but there's no reason why they can't collaborate and work together.
Thank you, Terry. Very helpful. Hopefully that answers the question. Elsa, do we have other questions?
Yes. So the next question is from an anonymous attendee that asks, is that funding amount per year for 3 years, or is it spread out over the 3 years?
Great.
They
So
will- Oh,
go
I'm
ahead,
sorry.
Terry.
My understanding is that, this is not a reimbursement grant. This is a pay ahead, and the payments will come in quarterly payments. So I believe there'll be an upfront payment, as I've been told, of about a quarter of the amount, possibly a little more, because usually stand-up startup costs are more than ongoing costs. So they will work with you on that. And then every quarter, if it is a 3-year period, every quarter, 12 quarters, they'll get the same amount each time. The AG's office will also be informing them of the reporting requirements. There's a form, of course, some kind of status. What are you doing? How's it working? Anything to show, any successes, any benchmarks you've reached, performance measures, all of that will be like that. But the answer is yes, the payments will come in installments.
Thank you. Very helpful. Are we seeing any other questions in the chat, Elsa?
Yes.
Okay.
So we just received a question from Darlene Villalobos that asked, I work for an educational cooperative that serves 14 rural school districts. Can we apply on behalf of a few schools together, or do they need to have individual applications?
Great question. Terry, I believe it's if they have their own board, like if they are a public entity themselves, is that correct?
Well, right. I didn't quite understand the entity that she was describing, but in the statutes, Title 51 clearly tells you what a political subdivision is. And if you're one of those, generally it's a city, county, school district, career tech, and it can be a public trust if the beneficiary of the trust is one of those entities. So if you were a public trust jail, but the beneficiary, let's say, is the city, that might qualify in that trust category. We didn't get many of those last time, but so I really would have to know more about the entity that you're describing that serves all of those areas.
She added, we're considered a school district and have our own board.
Okay, if you're a school district, I mean, that's the key, because I think if this year's application is anything like last year's, I believe on the first page, they list, these different political entities, and you check box, which are you? So in this particular case, they would check the box school district, if that's what they are. Like other school districts with an elected board.
Yeah, specifically, it's OCIC, which I believe there's you might have said that 14 school districts, and most of those are very small. So that would make sense to put that together as opposed to 14 really small requests.
Right.
Great. That's a great question. And hopefully that answers it. Also, were there any other questions coming through?
Yes. Shelley asked, is it 105,000 a year or total for 3 years?
No, that seems confusing. And, our understanding is that's for 3 years. Okay, not for a year. Nick and I and Mimi and Scott's had some conversations about that, just to make sure that gets clarified. But that was my understanding at the last opioid board meeting when they had approved raising the tier, but previously the term was shorter. So they've made the terms longer, which you can be approved for, and then just stretched out the dollars. So I think that's the essence of the change, but we want to make sure that's clear. I met with the AG's office attorney today to tell him that's a really important point for a lot of people that are doing program planning and budgeting. Is it per year or is that the total for 3 years, which is what they've been saying. And if we mentioned before about the Attorney General's website, and I know Brooklyn's got it, there's a link to a webinar that they did just this past Monday. It was 2 people from the AG's office, and I would encourage people to go to there and hit the play button and see if that helps explain it.
Absolutely. So generally, we believe that that is, in that case, 105,000 for all 3 years. It sounds like there's a little bit more clarification to come out, but that's generally what the understanding has been.
Right.
Next question, if we have more.
Yes, we have a question from Jolene that asks, does the board resolution need to state that we are applying for the grant?
Terry, I haven't looked through fully the board resolution that you sent over and the requirement. I'm not fully aware. I know that it says in the application kind of what the requirement will be. But
Right,
I
the
don't-
resolution, yeah, I think the resolution is pretty plain and boilerplate, and you don't have to do it exactly like theirs. In fact, I would probably encourage any board that if you look at the example that I sent to Brooklyn, show it to their attorney and just make sure it conforms with what the board is comfortable and used by. And you'll see that it generally says it is our intention to support or approve the submission of this application to the Oklahoma Abatement Board. There's a lot of whereases and whereases, which you probably know what that means. But it's just that it's their blessing is what it is to the application.
Yeah, that specific one, it does say that they're applying for the grant and connecting it through the Attorney General's office. We have a resolution through the counties, much the same thing, and also because we're a joint application through the city. Real simple, but also gave us a chance when we did that to explain to the boards what we were doing and get some support for that. But yeah, that document is very simple.
And it is authorizing the application and the projects. So yeah, that is what the resolution would be required, is saying we as a board approve this application to go in. We also approve the projects that would be funded. Also, do we have any other questions?
No.
Great. Only one question that I thought could be helpful to touch base on, Scott and team on the FCS side. Could you speak to, were y'all involved with the needs assessment aspect of the application? At the city?
So there was a needs assessment at the county level in a survey format. And then for me, I've done a needs assessment mainly face-to-face in the schools and with the entities and with, as you can see, that board, the members of that advisory team. What are you seeing, in the crime data of our town? We have access to all of that across from the sheriff's department and the Claremore Police Department, and that's painted a good picture. But a lot of the needs assessment on our end has been individually with the leadership and entities in that level. But we did also do a survey. Nick, are you aware of anything else on your side?
Yeah, I'll just add that the community needs assessment, involved the survey, like you mentioned. It's important to bring a lot of different people together, community stakeholders and subject matter experts, to conduct and to implement. A lot of this work maybe has been done already. I mean, the community needs assessments, if you have a CCBHC, they'll have one, as well as the health department. And so it's kind of, I mean, I imagine it kind of like drawing on all the different community needs assessment that kind of exists already and people that do that work. And so it doesn't have to be onerous, I guess is what I'm saying. I think what's important is that you're bringing people together to kind of inform the design of the project. And so like, don't let it scare you at the same time. I mean, if you get the right people around the table, it's entirely doable.
And Brooklyn, I can send to you, because I try to send out as much as I can. So the National Association of Counties did a nice 1, 2, 3 page outline overview of what's a needs assessment and how do you do it. And it'll say like what Nick said, but it really has about 4 or 5 Q&As on there that gives people some guidance on who should be at the table, what should we be asking them, and how do we demonstrate need.
And I think what's really cool about what Scott's been doing in Rogers County and Claremore is that it's not like a one and done thing. It's, it's like, okay, we did it, in 2024 and we put our application together, we check the box. It's kind of the needs are changing, the partners, the strategies are changing. And so it's kind of a constantly evolving assessment and approach.
Really helpful. Thank you. Again, I know we've heard a couple times people be like, man, how do I put together a needs assessment? So just really wanted to hit on that.
Let me jump in real quick. I put a link to the drug overdose dashboard. Nick and I have spent a lot of time nerding out over this because we're stat guys, but it's been very helpful. You can customize that to your county, your area, as well as not just overdose, but non-fatal. And that data has lined up well with what we found in our recovery houses. For example, the demographic in Rogers County, where we see the biggest problem are males aged 35 to 45, and that's pretty much the majority in our county of the males in the recovery housing. But that's not the same in the next county over. So that is a good resource, and that can kind of start you on a path to find some other things that have already been done for your area.
Thanks so much for sharing, Scott. Yeah, I think it's just key to be able to show, hey, this is specific to our area. This is what we know about our area. And that's an incredible resource to be able to show that. So thank you. Well, with no more questions, we'll be on a little bit longer if anybody else does have a lingering question, but this is contact information for you to reach out to each of the different orgs kind of represented today. So please, again, if you need grant writing help, reach out to us at SOAR. If you want to talk further with Family and Children's Services, you can find them on their website and they have phone numbers. And then Nick and Mimi, if you have other contact information you'd like them to reach out to, feel free to stick that in the chat.
Yeah, put my email in the chat. Thanks,
Nick.
Yep.
Yeah, of course. And then for the Office of Attorney General, there's a couple of different resources here. You can get directly to Terry as AOL.com email address, but there's also some other resources specifically for Healthy Minds and others at the Attorney General's office. And then you can get a hold of Scott too. We have his contact information in there as well. But that is our webinar today. So thank you everybody who joined today and came on to learn a little bit more. I hope that this was helpful. If you have any follow-up questions, please reach out to us and we would love to connect.